Hello everyone, my name is Michelle Bunis and I'm presenting through the Nursing 891.3 course through the University of Saskatchewan about situation-specific theories and borrowed theories on October 25th, 2017. I'm excited to be presenting on such a relevant, interesting topic, and I'm excited to see where our discussion takes us this week. Our objectives for this week will be to define and understand situation-specific theories. We will then go in to explain how situation-specific theories are applicable to the nursing knowledge and practice. We will then begin to talk about borrowed theories and we will define and understand them better. We will then go in to discuss the ongoing nursing debate surrounding borrowed theories. And then we will review many fields of borrowed theories and how they're relevant to nursing. I wanted to just start off with a quick review of the categorization of nursing theories in regard to their level of abstraction. The most abstract are meta theories. These are the most abstract and universal. They're the broadest of our concepts, and often it's generating knowledge and theory and knowledge about knowledge rather than specific theoretical frameworks at this stage. The next level is our grand theories. These are highly abstract and the most complex and broadest of our nursing discipline knowledge. And it's this stage it creates the identity and boundary of our discipline. It's where the majority of our conceptual frameworks come from, and these theories cannot be tested. The next step is our middle range theories. These are more specific and less formal than our grand theories. It's explaining the empirical world and it's describing a phenomenon, and these are often able to be tested by a hypothesis. And the last stage is our situation-specific theories, which we'll be talking about today. To better understand situation-specific theories, I will begin with a definition by Melise. She describes situation-specific theories as a focus on specific nursing phenomenon that reflects clinical practice and are limited to a specific population or a particular field of practice. This is cited by Eam in our textbook on page 289. It's important to recognize in this definition our focus is on specific nursing phenomenon and having a specific population or field of practice. This is important as situation-specific theories are concrete and narrow and less abstract than middle and grand range theories. Also, these theories you're not able to generalize to other situations, which leads us to our goal of situation-specific theories, which is providing a blueprint or ready-to-wear theory for nursing practice. These theories are easily applied, and the interventions are often quite straightforward in regards to nursing practice. These theories were developed to help explain and develop answers in regards to the limitations of grand and middle range theories by describing, explaining, and providing an understanding of the diversities a client may experience in response to a specific phenomenon. These theories help connect theory, research, and practice together, but also incorporate the diversities, complexities, and different contexts an individual may experience in regards to a phenomenon. Because phenomenon related to patient care is becoming more and more complex, and our healthcare system is becoming more complicated with many factors influencing our care, it's important to recognize the importance of situation-specific theories in our practice, as it helps create a guideline and helps create best patient outcomes and individual respect in regards to our care. One of these one of the multiple factors that influence healthcare is increased patient diversity. And the ability for nurses to focus on a specific phenomenon related to a specific group is very important, as nurses are working with more and more culturally diverse groups. It's also an important goal of our discipline to develop knowledge that reflects the nature and the consequences of the diversities in response to health and illness on an individual level. Situation-specific theories come from many sources and are developed from many sources. These sources are middle-range theories, research and clinical practice, health and illness events, personal and social environments, the experiences or interpretations of patients and nurses, or the health inequities, gender issues, race issues, and ethnicity issues that we see on a daily basis. It's important to also realize that situation-specific theories often emerge from grounded theory research, and grounded theory research provides a way to describe what is happening and understand the process of why it happens. The characteristics of situation-specific theories can be narrowed down to the following. The first is being a low level of abstraction. The next is reflecting on a specific nursing phenomenon. So this is again being very narrow in scope and just applicable to a smaller range of phenomenon. It needs to be very context specific. So often there is a very limited number of concepts described. It needs to be able to connect to research and/or practice. And it should also be very easily applied in nursing research and practice. You need to be able to incorporate diversities, and also it needs to be limited in its generalization. The development of situation-specific theories is considered an integrated approach in our textbook. It discusses how conceptualization and the theorizing process can occur at once or over many years. It discusses how these steps do not have to happen in order, and they can be repeated or skipped in order to reach the end goal of a theory. The first step in the integrated approach is checking the assumptions for theory development. This is looking for multiple truths, looking at the evolutionary nature of the theory development, looking at the socio-political context of a given topic, and the nursing's perspectives of the phenomena. This next step is exploring the phenomenon through multiple sources. This is looking at the current existing nursing and non-nursing theories, doing literature reviews, finding the experience from research, education, and practice, and also looking at the collaborative efforts made on this topic or phenomenon. The third step is the theorizing stage. It begins with the initiation of theory development. You then work through the process stage and then to the integration, which is integrating it into practice. And then the fourth stage of the integrated approach is reporting, sharing, and validating, which is allowing your theory to be critiqued by your peers and allows for further development of your topic. This brings us to our first discussion question. Do you believe situation-specific theories have advanced the nursing science or practice? Why or why not? Please provide rationale. You can also just include the science aspect or the practice aspect in regards to situation-specific theories, and I'm looking forward to an exciting week of discussion with this topic in question. We'll now begin our talk about borrowed theories. Borrowed theories definition is it's a theory developed in another discipline that is not adapted to the worldview and practice of nursing. Some of the theories that are borrowed that nurses use in other disciplines is the sociological sciences, behavioral sciences, the biomedical sciences, administration and management theories, and learning theories. It's important to recognize that many of these disciplines and sciences concepts overlap, and that's often why nurses use these other borrowed theories, because their concepts are so relevant to our current practice. A frequent question is if borrowed theories should be used by nurses and if it impacts our nursing science and discipline. A viewpoint is by embracing borrowed theories and nurses testing, building, and extending the knowledge of other disciplines rather than developing our own nursing theory allows other disciplines to question our uniqueness and foundation as legitimate science. An argument is that we need to build our own nursing science rooted in philosophies and theories of nursing to ensure that practice and the vision of nursing is rooted in nursing-specific theories and discipline. This leads me to our second discussion question. Do you believe that the nursing discipline should use borrowed theories? Discussion can include pros and cons of borrowed theories and your opinion if we should be using them. Sociological science impacts nursing as it focuses on the interactions between human society and individuals. This is important to nursing as sociologic issues impact health and well-being of individuals, families, groups, and society. I'll just briefly discuss the sociological science theories. The first theory is exchange theories. It has a perspective in utilitarianism. The concepts of this theory are where individuals actively construct their social world and are motivated to control or condition their situation. A major concept is the greater good for the greatest number. It also has micro-level theories which apply to individuals, or macro-level theories which apply to a group. There is also many related theories to this. Some are general systems theory, and which includes open systems theory and social networks. General system theory includes concepts where a system as a unit is greater than its parts. A system has boundaries such as rules and values that permit the exchange of information between a group, and the change in one part of a system leads to a whole system change. Symbolic interactionism theory and role theory both focus on how humans relate to each other using language and symbols and how behavioral roles are attached to positions in social organizations. Conflict theory discusses how inequities in power are developed and how we question society and social processes. It's discussing how society likes to maintain system balance, but because society has different perspectives on situations, division and conflict can occur amongst each other. Chaos theory is where systems, no matter their level of complexity, rely on underlying order to seek stability. Postmodern social theory is focusing on the relative truths of each person and supports the belief that the objective of a theory is to open up alternatives and create new possibilities. The biomedical science is where nurses borrow knowledge and research from biology, medicine, public health, physiology, and pharmacology. The biomedical categories discussed in our textbook are theories and models of disease causation and theories and principles related to physiology and physical functioning. The theories and models of disease causation can include germ theories, where Louis Pasteur discovered germs can cause infection, and another theory is the web of causation, which is McMahon and Pugh, where they recognize that many factors can attribute to health problems. Example is heart disease. The theories and principles related to physiology and physical functioning include cell stages of stress, where a person goes through alarm, resilience, and exhaustion stages. There's also cancer theories, where Clavence and White in 1995 discovered there's the initiation, where the cell genetic mutation occurs. There's the promotion, where the genetic error continues, and the progression, where full-blown malignancy develops. Another theory is the pain management theories. These include the gate control theory, which is a relationship between pain and emotion. Highlighted are just a few of the many biomedical theories, and our textbook does highlight several more if you do choose to look into it. When we look at the knowledge we obtain from the behavioral science borrowed theories and how we use it in nursing practice and research, we recognize it's a psychological science, and the goal of these theories are to understand the activities and interactions among human beings and how they respond to stimuli. The behavioral science theories discussed in our textbook are divided into 4 separate categories. The first category is psychodynamic theories, and it's how the discipline of psychology and psychiatry attempts to explain the multidimensional nature of behavior and understand how an individual's personality and behavior relate. It's also understanding the identity of behavior. Examples of this are Freud's psychoanalytic theory Eric's developmental theory, and Sullivan's interpersonal theory, and they discuss the stages of development. The next category is behavioral and cognitive behavioral theories. These theories believe that personality is based on how a person developed, and personality is synonymous with behavior, and if behavior is changed, then personality is changed. They also discuss how behavior and personality are learned. Cognitive behavioral theories focus on thinking and behaving rather than the feeling aspect of a person. These examples are Skinner's operant conditioning, Beck's cognitive theory, and Ellis' rational emotive theory. The next category is humanistics theory. These are where a person's destiny is determined early in life. It also discusses self-actualization, where a person can contain the potential for healthy and creative growth from where they're originally at. These examples include Maslow's human needs theory and Rogers' person-centered theory. The last category is stress adaptive theory. This theory discusses how stress is inevitable and one needs to adapt to stress by coping. This is especially important to nurses, as nurses need to understand how an individual is able to cope with stress and respond to stressful situations. Successful adaptation to stress creates equilibrium, and the inability to adapt is considered disequilibrium. Some examples of this are Sell's general adaptation syndrome and Lazarus' stress coping and adaptation theory. I'm only going to briefly touch on the leadership and management borrowed theories. A lot of the theory focuses on effective leadership, which is the ability to influence followers, to inspire confidence, and to generate support among followers for the leader's direction and vision. This is from our textbook on page 355. Being a leader can be formal or informal, and our textbook does a really good job at covering the early leadership theories, the contemporary leadership theories, organizational and management theories, motivational theories, concepts of power, empowerment, and change, problem solving and decision-making processes, quality improvement strategies, and quality-based practice theories. We will now talk about the learning theories, which nurses used as a borrowed theory. These are centered around education and teaching. It is the process to bring about change in the way an individual understands information or changes the way they perform a task or skill. This is applicable to nursing as we facilitate learning for patients, family, and staff. Our textbook talks about the categories of learning theories as behavioral learning theories and cognitive behavioral theories. The theory I chose for learning theories was Piaget's cognitive development theory. This cognitive development theory occurs in stages, and Piaget says that everyone everywhere can use these stages in order to retain information, and it's universal. These stages are the sensory motor stage, the perioperational stage, concrete operational stage, and formal operational stage. This is important as teachers or educators. We need to find an appropriate level of education or teachings for an individual to meet the stage of their current development. This is applicable to nursing theory and research, especially in regards to children, as it's understanding their ability to assent, consent, or participate in research studies, and also understand a child's experience or coping ability in regards to an event or an experience. My last discussion question is to describe a borrowed theory and how you personally apply it to your practice. This concludes our presentation. I hope you were able to take something about situation-specific theories or borrowed theories and are able to apply it to your current or future practice. I look forward to an exciting week of discussion around these topics, and if you have any questions, feel free to reach out and contact me. Thanks.